Histrionic personality disorder (HPD) is a mental disorder. Look at this picture, shows that expressing excessive emotions, detail going on. Introduction. Histrionic personality disorder is a type of personality disorder characterized by excessive emotionality and attention seeking behavior. People with HPD often feel uncomfortable when they are not the center of attention and tend to display exaggerated emotions and behaviors to gain approval or attention. HPD falls under cluster B personality disorders, which are marked by dramatic, emotional, or erratic behaviors. Definition. Histrionic personality disorder is defined by the Diagnostic and Statistical Manual of Mental Disorders as a pervasive pattern of excessive emotionality and attention seeking. Beginning by early adulthood and present in various contexts, individuals with HPD may exhibit behaviors such as seeking reassurance, acting impulsively, and being overly concerned with their physical appearance. Types. While HPD is categorized as a single disorder, it can present with varying degrees and type of behaviors. Some subtypes often maintained include one, appeasing type, constantly seeking approval from others. 2. Vivacious type, charismatic, flirtatious, and sociable. 3. Tempestuous type, highly dramatic and prone to emotional outbursts. 4. Disingenuous type, deceptive, insincere, and manipulative in their behavior. Causes. The exact cause of HPD is unknown, but it is believed to result from combination of 1. Genetic factors, a family history of personality disorder or mood disorders can increase the risk. 2. Childhood experiences, trauma, abuse, or neglect during childhood might contribute to the development of HPD. 3. Environmental factors, growing up in a family where emotional displays are highly valued can predispose someone to develop HPD. For biological factors, abnormalities in neurotransmitter regulation may contribute to mood disability, which influences HPD. Behaviors. Risk factors. Family history of personality disorders or mood disorders. 1. Childhood trauma or neglect. 2. Being female, studies suggested that HPD is diagnosed more often in women than in men. 3. Personality traits. Individuals who are highly emotionally expressive and attention seeking are at high risk. 4. Cultural and social factors. In some societies, overemphasis on physical appearance and social status may lead to the development of HPD like traits. Complications. HPD can lead to several complications, including 1. Interpersonal difficulties, frequent conflicts with families, friends, and partners due to attention seeking behaviors. 2. Depression and anxiety. Difficulty managing emotions may lead to mood disorders. 3. Substance abuse. Some individuals with HPD may turn into drugs or alcohol to cope with their emotional instability. 4. Suicidal behavior. Emotional crisis and impulsivity may increase the risk of suicide attempts or self-harm. 5. Poor work performance. Inability to maintain focus on manage responsibilities at work due to preoccupation with personal issues. Pathophysiology. The pathophysiology of histrionic personality disorder involves a complex interplay of genetic, biological, environmental, and psychological factors. Though the exact mechanisms are not fully understood, the following step by step process outlines the hypothesis. Progression. 1. Genetic predisposition. Genetic factors, neurotransmitter irregularities. 2. Early developmental factors, childhood experiences, attachment issues. 3. Emotional dysregulation, brain structural and function, amygdala, prefrontal cortex, heightened emotional sensitivity. 4. Cognitive distortions, excessive attention to approval, distorted self-image. 5. Behavioral manifestations, exaggerated emotional displays, impulsivity, manipulative interactions. 6. Social reinforcement, interpersonal reinforcement, relational instability. 7. Chronic emotional instability, cycle of dependency, co-occurring disorders. This step-by-step process helps explain the underlying mechanisms that contribute to the development and maintenance of HPD. Signs and symptoms. 1. Excessive attention seeking, constantly seeking reassurance and approval. 2. Emotional overaction, exaggerated emotion or shallow, rapidly shifting emotions. 3. Inappropriate sedative behavior, often behaving in a flirtatious or sexually proactive manner. 4. Concern with physical appearance, overly focused on appearance to gain attention. 5. Dramatic behavior, displays dramatic gestures and expressions. 6. Easily influenced by others, highly suggestible and influenced by others' options. 7. Unstable relationship, often has difficulty maintaining long-term meaningful relationships. Diagnosis. Diagnosis of HPD is based on a clinical evaluation including 1. Psychiatric assessment, through interview to evaluate personality traits and behaviors. 2. DSM-5 criteria. Diagnosing HPD requires meeting at least 5 of the 8 diagnostic criteria from the DSM-5, such as discomfort when not the center of attention, inappropriate sexually sedative behavior, rapidly shifting emotions. 3. Exclusion of other disorders. Differential diagnosis to rule out other personality disorders, mood disorders, or medical conditions. Nursing diagnosis. 1. Disturbed personal identity related to fluctuating self-esteem and need for validation. 2. Impaired social interactions related to attention seeking and manipulative behaviors. 3. Ineffective coping related to emotional dysregulation. 4. Risk for self-harm related to impulsivity and emotional instability. Management. Managing HPD involves in multidisciplinary approach. A. Psychotherapy. 1. Cognitive behavioral therapy, CBT, helps individuals recognize and alert their maladaptive thought patterns and behaviors. 2. Psychodynamic therapy focus on exploring past experiences and unconscious emotions that contribute to HPD symptoms. 3. Group therapy provides an opportunity to improve interpersonal skills. B. Pharmacotherapy. Medications are generally used to treat co-occurring conditions like depression or anxiety, such as antidepressants, mood stabilizers, anti-anxiety medications. C. Supportive therapy involves building a supportive and therapeutic relationship to help individuals gain insight into their behaviors. Treatment. Treatment is centered around psychotherapy. One long-term therapy is essential to help individuals with HPD develop healthier emotional and interpersonal strategies. Two medications may be prescribed for associated disorders like depression or anxiety, but do not treat HPD directly. Psychosocial medicine. In psychosocial terms, HPD affects both the individuals and their social environment. One, strained relationship. Excessive emotionality can lead to unstable relationship with family, friends, and romantic patterns. Two, occupational issues, problems maintaining professional boundaries and focus at work. 3. Social isolation. Over time, attention seeking behaviors may alienate others, leading to a loneliness. Prevention. There is no guaranteed way to prevent HPD, but early intervention can help. One, psychotherapy for individuals showing early signs of emotional instability and attention seeking behavior. Two, supportive environment that provide healthy emotional regulation and attention can reduce the risk of developing HPD traits. 3. Education and awareness about the disorder can help family members and friends recognize early signs of HPD and encourage professional intervention. In conclusion, histrionic personality disorder is complex disorder marked by excessive emotionality and attention-seeking behavior. While its exact cause are unclear, HPD is believed to arise from combination of genetic, environmental, and psychological factors. Effective management typically involves psychotherapy and sometimes medication to address co-occurring conditions. Early diagnosis and intervention are key to improving quality of life and reducing the impact of the disorder on interpersonal relationships and overall functioning. This disorder, if untreated, can lead to complications like depression, anxiety, and impaired social occupational functioning. However, with appropriate treatment, individuals with HPD can learn healthier ways to express emotions and interact with others. Thank Thank you. Have a wonderful day.